Once again, good morning, everyone. Welcome to the PAP Webflix series, a collaboration with the Philippine Academy of Family Physicians and the Foundation for Family Medicine Educators Incorporated. For this morning, we will have Dr. Ara Bel Colleen Opina as the moderator. She is a member of the Board of Trustees of the Foundation for Family Medicine Educators Incorporated and the chair of the Palliative and Hospice Care Program of the Department of Family and Community Medicine of the Hospital ng Makati. Please welcome Dr. Arabel Colleen Ofina.
Hello, good morning, everyone. Thank you, Dr. Lims, for that very kind introduction. So I'm seeing a lot of attendees from all over the Philippines. We have attendees from Luzon, Visayas, and Mindanao. Thank you for spending your Saturday morning with us. Okay, it is a privilege to host and also to moderate this session. So without further ado, may I introduce as we formally open the webinar for this morning. Next slide. Okay. So let us welcome our very dedicated and active FAMED President, Dr. Florentino Berdin. Take away. Hello, Dr. Junjet.
Yes, good morning. May buntag sa tanan. Thank you for that, Dr. Ofida. So as mentioned earlier by Dr. Ara, thank you very much to each and everyone, my buntag dear colleagues and friends. And thank you for spending your Saturday morning with us. We are 493 strong participants and counting, I believe, as more educators would be logging in later. So in behalf of the Foundations for Family Medicine educators, I would like to welcome dear educators and future educators as well to this morning's webinar, which is how to teach PFC, that is patient-centered, family-focused, community-oriented, which one of our cores as family physician, and that would sort of set us apart from the other specialists. So I will not prolong your eagerness to learn. Again, thank you very much, and let's sit and enjoy and learn in this morning's activity.
Thank you so much, Dr. Berdin. So I think 2 Saturdays ago, Dr. Leopando delivered a lecture on PFC matrix. But this afternoon, this is again a very important topic, especially for us educators and as faculties, because this morning we will be learning how to teach PFC matrix. And we are very privileged because we have another distinguished speaker to talk about it. I will be introducing now our speaker. Presently, he is the Executive Secretary of the Philippine Academy of Family Physicians, the Vice President also of Foundation for Family Medicine Educators, or FAMED. Currently, he is the chair of the Subcommittee on Preventive and Promotive Health Technologies of the Philippine Health Technology Assessment Council. He is also the regional director for Luzon, Dementia Society of the Philippines, an associate professor of Ateneo in Public Health, and presently he is also a consultant of Amosup Siemens Hospital Department of Family and Community Medicine. So he's also very close to my heart because when I was a pre-resident, he was my chief resident in UPPGH. So please welcome Dr. Limuel Anthony Lims Abrojena.
Thank you very much, Dr. Ara, for that generous introduction. So again, I am grateful for this opportunity to share this knowledge in teaching the patient-centered, family-focused, and community-oriented paradigm. As Dr. Ara had mentioned earlier, so 2 weeks ago, we actually had this session also, but this time discussing the different content of the patient-centered, family-focused, and community-oriented paradigm in patient healthcare. Of course, delivered by no less Dr. Zoraida Leopando, who actually developed the concept of PFC. So before I start, I actually have been teaching PFC when I started my engagement at the Ateneo School of Medicine and Public Health. And I have continued it also sharing with now my students who are rotating in our hospital, the Amosup Siemens Hospital Manila, with our clerks from Fatima University, Department of Family and Community Medicine. So I hope that this morning session will be short, and you'd be able to get some information in terms of how to prepare your sessions with the PFC. So let me just share my slides. I hope my slide is okay now. So for this session of the PAP Wide Click series, so we will be discussing about how to teach PFC. And I have seen in our lineup of our audience, so there's a lot of colleagues who have been also our colleagues in the basic medical education, as well as those in the residency training programs, facilitating our learning in family and community medicine. And I think there are some guests also who are joining in. And we hope that we would be able to simplify how to teach PFC in the following slides. So let's start, of course, with what our learning outcomes. So since this is a teaching webinar, so definitely we need to know what are our learning outcomes. So I will be briefly discussing the different components of the PFC matrix. So this is just our review, because you can still actually watch the presentation of Dr. Leopando in the PFP webinars website or our platform. So you can review that. So I will just be discussing a few, reviewing the different components of the PFC matrix. But the heart of our discussion for this morning would be to develop an instructional design to teach PFC. So I will be demonstrating, maybe sharing with you, what are the important points, contents in our developing an instructional design to teach PFC. And of course, lastly, to appreciate the value of teaching PFC. So these are our learning outcomes for the morning. So just a review, what are the components of the PFC matrix? This was excellently discussed by Dr. Leopando last 2 weeks ago. Okay, and if you look into the PFC matrix, okay, so the PFC as a paradigm, okay, we use it in healthcare management. Now, in medicine, okay, so we've been taught, okay, actually the patient-centered part. Okay, so we've been trained to look at patients, okay, in terms of the biomedical component. One important concept in PFC is that we tie it up with another paradigm in family and community medicine, which is the biopsychosocial approach. Okay, so the BPS, and if you would notice, okay, a lot of this, a lot of that concept in BPS is actually integrated in the different tiers. Okay, your patient-centered, family-focused, and community-oriented. Okay. So let's just review, okay, what are the components in the patient-centered. I've mentioned as medical students, okay, and trainees in family and community medicine, hasang-hasa po tayo, okay, in looking into the patient-centered part, especially in the biomedical aspect, okay, looking into, okay, and generating relevant clinical histories and doing, okay, focused physical examinations. Okay, the information that we get from your clinical history and your physical examination will be our basis for your differentials and of course your diagnosis, and eventually, okay, be the basis of your management, including your diagnostics, your therapeutics, and your non-pharmacologic interventions, an emphasis of which is looking into your preventive and promotive aspects of cares when you now discuss it with your patient. But that's just the biomedical. Of course, in family and community medicine, we also emphasize, okay, the psychosocial context, okay, when we take care of our patients. Okay, so we look into the emotions attendant to the health condition, including biomedical issues, bioethical issues. So gentle reminder for all the participants to kindly mute your microphones. All right, thank you very much. In terms of analysis, Secretariat, so please watch out for our participants who would unmute, okay, so that it won't be distracting. Thank you. Okay, in terms of analysis, so that would be salient clinical features and psychosocial issues, okay, relevant to the patient care. Our diagnosis will be anchored in terms of course, the medical diagnosis and the psychosocial diagnosis, okay, especially that of which using the ICD 5 codes. Okay. And then we have management and intervention. So you have your comprehensive medical interventions based on evidence and standards of care, encompassing all levels of care, okay? And your individual psychosocial interventions, such as your psychoeducational approach. Okay, in our example here, we have your catharsis, education, action counseling, your motivational and behavioral counseling, appropriate to address the identified issues. In the family focus here, okay, so for data gathering, so you have your assessment of family psychodynamics using your family assessment tools and your family systems assessment. Our analysis is anchored to the salient features of the family dynamics and or family systems assessment. Okay. Our assumptions would include the summary statements of the issues identified in the assessments done, both enabling and barriers to care. Our intervention would include family interventions such as family meeting, your home visits, okay? And this is to address both medical and psychosocial issues identified not just by the family, but of course, okay, not just by the patient, but of course, including now the other family members. The last tier would be your community-oriented tier, okay? The assessment of social determinants of health and the building blocks of the health system relevant to the presented medical and psychosocial issues of the case, okay, is the one that would be included in the data gathering. Okay. Analysis would include the assessment of the social determinants and the building blocks of health system so that we would be able to identify what are the needs and issues. Okay. So this would also include the enabling and barriers to care. And our intervention would be your community-oriented primary care-based interventions, okay, that would actually help the patient and the family navigate this issue. Okay. So that in essence, okay, would be the different components of your PFC matrix. And again, you can review, okay, the session presented by Dr. Leopando last week in the PFP webinars. To read more about the PFC matrix, you can actually now scan this QR code, okay, and you will be actually have a copy of the article on the PFC matrix written by Dr. Leopando together with Dr. Lani Nicodemus, Dr. Ana Limpoco, and Dr. Tricia Bautista. So you can have the time to scan the QR code now. All right. So we will now proceed to the next part of this session, okay? And that is actually looking into, okay? Meron nakalimutan pa pala akong i-discuss sa part na to. Sorry. So what are the uses of the PFC matrix? Okay, so of course, okay, it is used as a teaching method to enhance understanding of the biopsychosocial approach in the undergraduate courses. Okay. Then the framework, integrated biopsychosocial analysis of clinical cases in different settings in residency training. Okay. Using it as a for the biopsychosocial patient chart recording for family health units or family healthcare programs. And lastly, as a curriculum framework for the practice-based family community medicine training program. Okay, so these are the uses, okay, of your PFC matrix. Okay, and what I'm going to demonstrate later, okay, is to integrate it in our undergraduate courses or residency training. So, but there are some assumptions, okay, when we now teach your PFC, okay, and that premise, okay, includes knowing the basic concepts in family and community medicine. Okay, so we've already mentioned about the biopsychosocial approach. Okay. What are the different family assessment tools that we will be teaching? Okay. What are the family system assessments? Okay. Of course, we should also be familiar with the social determinants of health, the WHO building blocks of health system. Okay. As an example, the catharsis, education, action, counseling. Okay. Of course, okay, the knowledge, okay, in developing community-oriented primary care projects. Okay. And of course, in overall, okay, concepts about the universal healthcare, because we also integrate it, okay, when we discuss your PFC matrix, okay, such as, okay, individual and population-based interventions, okay, health financing, okay, the use of guidelines in the care of patients, etc. Okay, so these are basic assumptions when we now teach, okay, when we now teach your PFC. Okay, so if you do not, if you are not familiar of this concept, so okay, it is important for us, okay, for you to review, okay, these concepts, because these are valuable when we teach your PFC matrix. So let's us go to the heart of this talk, okay, in terms of the instructional design in teaching PFC. Okay, so I hope that this would also guide, okay, those who are module coordinators of family and community medicine, okay, as well as the various residency training programs. So what could be our course title or module title siguro? Okay, so maybe we could start with UFC, use of PFC approach in managing patients. Okay, so some of you might have actually joined previous webinars, okay, and PFP webinars are encouraged to use the PFC approach, okay, when we present, okay, discussions, okay, relevant to patient care. Okay, so you might have attended PFC approach in the management of hypertension or diabetes. Okay, so there's a lot actually, okay, that we have been using the PFC approach, okay, in our presentations in our various PFP webinars. Okay, so this could actually be your course title. So what other suggestions? So it can just be plain PFC matrix, okay, or systems thinking using the PFC matrix. That's actually the title that I have borrowed from Dr. Josie Isidro. Okay. components of the PFC matrix if you just want to zero in on the components of the PFC matrix. Okay. So now let me ask the audience. Okay. So can you type in the chat box? Okay. What are your other suggested title for this course, okay, on PFC? We are also being broadcast on Facebook, I think. So our Facebook participants, you can also join in. Type in the chat box at the Facebook, on Facebook. So what other titles can you think of for your course? Ay, mahihain ang ating audience. So some of you who knows me on how I facilitate webinars, okay, I actually engage the audience. So yung iba okay na daw yung current title. Okay, so I've been saying PFC matrix in action, PHC paradigms. Okay. So our upcoming convention, which will be on March 7, 8, and 9, actually naka-PFC po siya ha. If you would notice. Okay. So yung P doon is yung paving the way for ano yun? Collaboration yung C doon. I forgot the F. Okay, so thank you very much, okay, for our active participants. Okay, holistic approach to healthcare, the PFC approach. Okay, so you can think of a lot of titles for your course title. Okay, so it would also be dependent on your need. Okay, so thank you very much. Okay, so some of you might want to take a picture of the different answers of our co-participants. Okay, kasi it could also help you in your when you prepare your instructional design. Okay, so this would be the course title. No? So use of PFC approach in managing patients. So that's just an example. So next step would be the needs assessment. And very important when you do your needs assessment, okay, are these two important points. You identify the audience and you analyze the learning goals. Okay. When we identify the audience, of course, we want to determine the target audience and their existing knowledge. Okay. Because we will anchor it now. Okay. We will anchor, this is where we anchor, okay, our analysis of learning goals. Okay. When we analyze the learning goals, okay, we understand the specific topics to be covered that would now address, okay, the particular needs of your audience. Okay. So let us discuss some examples. Okay. Who are your intended learners? Okay. So in the basic medical education, okay, so some of you might be introducing the PFC approach with your first and your second year medical students. Remember, your first and your second year medical students, since they are just starting, you might just be introducing the concepts of biopsychosocial approach, okay, or introducing the patient-centered, family-focused, community-oriented paradigm in healthcare, your PFC. Okay? So pwedeng yan yung mga itinuturo pa lang natin at this basic medical education level. Pagka umakyat ka pa, okay, so perhaps your third year medical students, so medyo may alam na sila, di ba? Meron na silang alam in terms of patient care, may mga diagnosis na sila. We've also been teaching them, okay, sa pharmacology, ano yung mga gamot, okay? But of course, looking into the social component, so if you give your patients this medicine, so will they be able to buy it? Okay. Will it be available in their locality, etc.? Okay, so that's your psychosocial component. Okay, so what is the reaction of your patient regarding her disease? Okay, so relevant yon. Okay, so this time, okay, medyo tumataas na yung kanilang level of understanding about this concept. So you can now actually ask them to apply the PFC matrix in analyzing a clinical case. Okay, so you can start that simple. Okay. So that's for your third year medical students. Okay. How about for your fourth year medical students or your postgraduate interns for some institution, okay, or resident trainees, and even practicing family physicians. So you can actually now ask them to demonstrate a patient-centered, family-focused, community-oriented approach in managing a disease. Okay, so you can uh, really target that. Okay, so these are example of your needs assessments. Okay, so you really need to identify who are your learners. Okay, um, my discussion with Dr. Limpoco and Dr. Berdin previously, when we are preparing for this um, uh, lecture, okay, is that magle-lecture na si Dr. Leopando. So, ano yung dapat kong ituro? Diba? So, and then they advised me to focus actually really on how would we prepare as teachers, okay, when we teach PFC, okay? So, and now I have to identify who are my target audience, okay? So, these are teachers, okay? So, what would be their needs, okay? So, Dr. Leopando has already given them the context and the content. Okay? So, baka ako, kailangan ko na ilalagay sa framework. Okay? So, paano ba namin ito ituturo? Okay, and when we prepare for our course instructional design, okay, so we would be able to put something there. Okay, so yun yung naging preparation ko for this lecture, and that's needs assessment. Okay, next part is knowing what do you want to know, okay? Okay, or what do you want your learners to know? And that would be now anchored to the different course objectives translated to your learning outcomes. And earlier, okay, so we've actually discussed, okay, what particular topics are you interested in? Okay. So when we now formulate your course objectives and learning outcomes, of course, okay, it should be using the SMART goals, okay? So that there would be a clear learning objectives, okay? So what's SMART? Okay, specific, what exactly are you trying to achieve? Measurable, how will you know when you have achieved, okay, your goals? Okay. Attainable, is it genuinely possible to achieve it? Okay. R stands for relevance. Here, does it contribute, okay, to your agents revenue growth, okay, on in our parlance, okay, does it contribute to the knowledge and skills of your students? And of course, it should be timely. Okay, so when do you want, okay, to achieve this? The next is your HOTS objectives. Okay, align your objectives with the knowledge, skills, and effective domains of learning. And you have your Bloom's taxonomy actually. I always run to the Bloom's taxonomy so that it would guide me of what words to use, what verbs to use when I formulate my objectives and my learning outcomes. And it's very important to use the HOTS, okay? Your higher objective training, I don't know, higher outcome teaching skills, okay? When you formulate your objectives, okay? So that's your HOTS. So, okay. So giving some time for people to take pictures. Now let's discuss examples. Okay. So the following slides are actually examples. Okay. This may not be necessarily the one that you will be using. Okay. But these are suggestions. So let's start with understanding the biopsychosocial approach. Okay. So what would be our course objective here? To comprehend the significance of integrating biomedical, psychological, and social factors in patient care. Okay. What could be our learning outcome? The learners will demonstrate an understanding of the BPS model and its relevance in family medicine. Okay, so that could be an example of learning outcome. How about the topic on exploring the PFC matrix? I saw in the chat box, okay, some of you who have mentioned that actually as a topic, okay, or their course title. Okay. So our course objective here is to introduce the PFC matrix as a practical tool for holistic patient management. What would be our learning outcome? So learners will be able to describe the components of the PFC matrix, and the role in patient care. Okay? So that this can be your example course objectives and learning outcomes for your PFC. So other exercise. Okay. So, paano, especially for me, no? I've been using PFC as part of the integration and application. So I've been teaching this for my clerks and my interns as well as my residents. So medyo higher na, di ba? So in-expect ko na sa kanila actually at the level of integration and application. Okay? So please write in the chat box, okay, what could be your course objective? Okay? So your course objective, if you have this topic, integration and application of PFC matrix. So what could be your possible course objective? Anyone? Yeah. Dr. Rafina, to apply PFC matrix in patient management. Very, no? Very simple. Pwede naman. Okay, so application. Okay, nag-iisip pa? Sana nakapag-coffee na kayo para mas, mas dynamic mga answers. Yan. Okay. Apply PFC matrix in the COP project. Okay. Thank you, Dr. Ruth. Dr. Arnold, demonstrate PFC matrix and patient care. Okay, so these are examples. Okay, so includes technology stimulation. Okay, very good, which we will actually be discussing later. Okay, so you can continue writing your course objectives in the chat box. Okay, so an example na ginawa ko, as mentioned by Dr. Ara, okay, to integrate, okay, or to apply the PFC matrix concepts into clinical practice. That's simple. Okay. How about learning outcomes? So what would be your learning outcome for if this is your course objective? To create management of patient using the PFC matrix format. Thank you, Dr. Carla. Able to apply PFC matrix in clinical practice. Thank you very much, Dr. Velasco. Learners will be able to apply PFC matrix in management of patients. Medyo bumibilis na. So medyo gising na yung ating audience. Okay, so keep on writing on the chat box para we could also share this with our other participants. Okay, so an example for integration and application as for the learning outcome, learners will use the matrix to manage patients holistically, create family support environments, and navigate community resources. So tatlo yan. Okay. So holistic patient management, creating family support environments. So that's an understanding of the family dynamics of the patient, and navigating community resources. So you have already identified what are the available resources in the community, and you will now be helping your patient and the family to navigate this one. Okay, so of course, okay, the students or the learners will be the one who would now recommend, okay, what are the steps, okay, that they will be suggesting to their patients and their families, okay, when they now navigate community resources. So that's an example of your learning outcome. So let's discuss naman about evaluating impact. So what would be your course objective for evaluating impact? You can write it on your chat box. We also encourage our friends who are in the Facebook page. Okay, there are 253 right now. Good morning, everyone. So you can also write on the chat box in Facebook. Okay. What would be your course objective if you want to evaluate the impact of PFC in teaching PFC? Oops. Course objective. Medyo mahirap ba yung evaluating the impact? Monitor and review PFC target outcomes. Thank you very much, Dr. Evelyn from Davao. I think I missed something. Dr. Kagulada to determine if there were, oops, medyo mabilis, changes either in biomedical and psychosocial aspect in the patient. Okay, very good. Okay. In this case, especially in evaluating impact, so pwedeng patient outcomes or pwede din na nakatutok pa din dun sa learner. So how did your learner improve in terms of patient management? Okay. So that having said, so assess the impact of using the PFC matrix on patient outcomes is an example. Okay, for the learner, you can actually also assess that. Okay, so how the learner had improved, okay, in terms of patient management using the PFC matrix. How about learning outcomes? So if you are evaluating the impact, so learning outcomes. Nagulat siguro kayo, no? Para siya tuloy workshop. So what would be your learning outcomes when you're looking into impact of the topic on PFC matrix? Yung impact assessment, actually medyo mahirap nga to, no? So, kaya mahirap siyang lagyan ng course objective at saka formulation of the COPC project. Actually, that's one, okay? Because the part of the understanding of the PFC matrix, of course, is that they would be able now to recommend a COPC project that would help the patient and the family utilize community resources. Okay. So keep on writing in the chat box. So what is an example? Learners will critically evaluate the effectiveness of the matrix in improving health outcomes. Okay. So that can be an example of your learning outcome. Okay. So these are topics, okay, that you can look into for PFC matrix. Now, you can also be very specific. Remember, there are 3 tiers: your patient-centered, family-focused, and community-oriented tiers. Okay. And you can actually be specific on this. Okay, so you can actually divide the topics into sub-sessions or sessions. Okay, so if you have a course, okay, so pwedeng on this day, patient-centered care muna yung pag-usapan natin. The following day, family-focused assessment. And then the next day, community-oriented perspective naman. So you can have now, pwedeng not a course objective, pwede kasing bababa siya as in session, learning outcomes lang. Okay, kasi mas maliit siya na topic eh. If you have the bigger topic on PFC matrix, tapos you want to divide it into these 3 tiers, okay, so session, learning outcome siya. Okay. So example of which, okay, so to apply patient-centered principles using the PFC matrix, okay, and your learning outcomes is for your learners to assess patient needs, preferences, and values to tailor management plans accordingly. Okay. So pwede na kayong dito mag-discuss din other parameters, not just the biomedical and the psychosocial components, but you'd also now look into patient values. Okay. So patient preferences. Okay. Sa ethics, okay, so yung patient autonomy, pwede nyo nang pag-usapan din dito. Okay. So there's a lot actually of topics that you can actually integrate as well, okay, when you teach your PFC. How about family focus assessments? Okay. So to utilize family assessment tools within the PFC matrix. And as a learning outcome, learners will generate assumptions about how the family dynamics impact patient management. In the example of Dr. Leopando, okay, so she used diabetes as an example, no? So in our family assessment tool, so one family member has diabetes. Okay, so how will we now be able to communicate it with the family using the PFC matrix? Of course, you will be using the genogram to identify who are the other family members who might be at risk of developing diabetes. Okay, we look at the different uh, support that is being given by the other family members to your patient. Okay? Will they be willing to sacrifice their diet when you now encourage the family to also go on a diet? Okay? Kasi unfair naman kung yung isang family member lang yung pagda-diet nyo para ma-improve yung kanyang sugar. Dapat the other family members should also be engaged. Dapat pati sila kasama sa diet. Okay? So, dito natin lalabas ngayon sa learning outcome yun. How our learners will be able now to engage the family. Okay? Using now the different information that they were able to generate, okay, using the family assessment tools. Your community-oriented perspective. So what could be a possible course objective? To recognize the influence of social determinants of health and health systems. And as a learning outcome, the learners will be able to analyze how larger systems support or hinder care provision. Okay. For diabetes, okay, so for example, for diabetes, okay, so does the family, okay, does your patient and the family know about PhilHealth packages for diabetes? Or do they know that there are available diabetic medications in the health center? Okay, so that they can actually access this free medicine so that it would lessen, okay, the healthcare costs. So these are examples of learning outcomes, okay? If you want to be specific in terms of your patient-centered, family-focused, and your community-oriented perspective. Excuse me. Okay. So we will now go to the next topic. Okay, so I hope this is helpful for everyone, your course objectives and your learning outcomes. Okay, content development. Okay, so in terms of content development, three important points should be considered. Okay, curriculum mapping, your content creation, and your real life scenarios. Okay, so in terms of curriculum mapping, okay, so you organize the topics into a logical sequence. So you can actually start by introducing your biopsychosocial approach. Next is to discard your patient-centered perspective in healthcare. Then your family-focused interventions and your community-oriented perspective. So pwedeng ganun yun. Okay? So some of my students who are now, okay, residents in family community medicine, okay, I think in the audience is Dr. Zach Valera. Okay, if he remembers, I do not just stop in the PFC matrix. So once they have developed the PFC matrix, okay, sinasama ko doon yung problem objective 3 until their action plan management so that they would be able now to develop programs, actual COPC projects, community-oriented primary care projects that the students can actually be able now to facilitate while they are rotating in family and community medicine. Okay, so that's your curriculum mapping. Next is your content creation, developing engaging materials that explain the PFC concepts. Okay, so you can now input here, okay, yung mga various topics, okay, or other subjects, okay, that would now complete, okay, the topics that you have identified. For example, so family-focused intervention. So you will need to discuss about family assessment tools. So you enumerate now the different family assessment tools that your learners can use, okay, when they now assess the dynamics of the family. Okay. You can use infographics, case studies, and videos. How about real life scenarios? Okay, it's very important in content development as well to include relatable examples to illustrate concepts. Okay, so I always use, okay, as part of teaching family screen, no, not family screen, but rather family APGAR, especially the growth. Okay. Uh, can I show of hands? Okay. Sino po nakapanood ng Rewind during the Metro Manila Film Fest? Okay, uy, medyo marami-rami. Okay, show of hands. Okay. So, for those who haven't pa, please watch. Okay? So, ano to, pastime ko to pag nanonood po din ako ng movies, tinitingnan ko, pwede ko ba itong magamit as a tool, no? So, for example, in the movie Rewind, okay, there's this particular scene, okay, na nag-aaway, na-discover ni Ding Dong na paalis pala si Marian going to Singapore. Tapos, in the story, okay, so gusto kasi ni Marian naman na mag-grow as a person. Okay? And yet, nagagalit si Ding Dong. Bakit hindi mo sinabi sa akin, etc. So, what particular part of the family APGAR this is reflected on this? Family APGAR, adaptation, partnership, growth, affection, resolve. That's your family APGAR. So, paano nyo siya i-relate sa family APGAR? Yung scene na yon. Can you write it in the chat box? Okay. So actually, I use this as my example for growth na. Okay? Nung dati, syempre, iba yung example ko. Pero now, dahil may rewind, I like it. So I usually cut pagka available na. Syempre, ayaw natin i-promote ang piracy. Pag available na yung video ng rewind, I would want to cut that part, that scene. Para yun yung ipapasok ko every time I discuss family APGAR. It's a growth. Okay? You are correct. Okay? So, bakit hindi sinusupport ni Ding Dong yung growth ni Marian as an individual? Okay? So, syempre, pagka in-score ni Marian, malamang yon, baka mababa. 0 or 1 pa yung magiging score niya. Okay? So those are example, no? So there's a lot of materials that is available for us, okay, that we can actually use now, okay? Create it so that we would actually be able to identify it. Okay? So as part siguro of our advocacy siguro, so we can help, okay, the audience create these materials, these available materials, okay, so that we can actually share it to you so that madali nyo din silang ma-identify. Okay, so that's an example. So that's content development. Okay, next, instructional strategies. So what could be your strategies when you now teach your PFC? Okay, so very basic would be your lectures. Okay, so ako, guilty ako dyan. Okay, so yan yung pinakamadali. So you give your didactics. Yeah? So you deliver concise, informative sessions on each topics included. Okay, but at the same time, like the one that I'm doing, no, hindi lang ako yung nagsasalita. Okay, so hindi man kayo nagsasalita, I engage you. Okay, so you have your interactive activities as well. So group discussions, okay, simulations to reinforce learning. So what is my simulation? So I throw you a question, okay, so you answer back through the chat box. So that's simulation. And that's actually a way for me to also gauge if my audience is also learning. Okay, so that's interactive activities. In the picture, you have an example of guest speakers. So you invite resource persons to share practical insights. So as we have mentioned, Dr. Leopando 2 weeks ago gave this very relevant and timely discussion on the PFC framework, the biopsychosocial approach to care. Okay, so that's guest speakers. And lastly, as part of the strategy, hands-on practice. Okay, so here, okay, pinakamataas pa din is yung actual patient, family, and community engagement. Okay, so that's why isang example ko earlier, no? Pagkadating ng third year or okay, lalo na pagka fourth year or fifth year, postgraduate internship, and then syempre, of course, resident trainees and practicing family physicians, it would be good, okay, to actually use your actual patient, okay, and their family and the community that they live in, so that it would be the activities, okay, could be more uh, anchored into reality. Okay, so of course, okay, you can use case studies. Okay, so many examples pagka nag-webinar tayo, di ba? May case scenario tayo. So that's included in the paper case. Okay, so we will be giving you a case scenario, giving the history, the physical examinations, and then yun na siya generate. Okay, what you would need now is to be able now to identify, okay, how this information will be plugged in your PFC matrix. Okay, you can also do movies. Okay, in this example, okay, I've been using Seven Sundays. Okay, why Seven Sundays? Okay, but before why, okay, can I again ask, okay, show of hands, okay, who are familiar with the movie Seven Sundays? Uy, marami din. Okay. So, I encourage you to watch Seven Sundays. Okay? Kasi ang dami yung matututunan siya. And actually, Seven Sundays is one of those movies that you can actually use in family and community medicine, not just in PFC Matrix. Okay? Kasi it has very nice discussion, ang ganda ng examples and the dynamics, etc. Okay? So, you can actually watch this on Netflix. It is available, especially after the death of Sir Ronaldo Valdez. Actually, nabuhay ulit ang Seven Sundays. Okay, so watch it. Okay, I encourage you to watch it. Okay, assignment nyo yan. Okay, so how do I use Seven Sundays? Okay. Actually, Seven Sundays is the main, during the pandemic, I used Seven Sundays, okay, for PFC Matrix. Okay, so I asked my students to watch Seven Sundays, okay, the whole movie. Dapat hindi nila i-chop-chop. Okay, the advantage of watching a movie is that they would be able now to identify ano yung naging development. How did the family reacted to the issue? Okay, so and then they will now plot in the PFC matrix. Okay, one setback in actual patient family community engagement is that our students rotate very short. Mine is only 1 week. Okay, for clerks, okay, and then interns 8 weeks. Okay, so medyo 8 weeks medyo kaya pa. Okay, pero yung 1 week mahirap makita nila yung changes of their intervention. Okay, so kaya when they write the PFC matrix, some parts of there are assumptions. Okay, mga wish list. Okay, but when you're now watching a movie, makikita na nila yung ano yung development ng characters and then yung resolution ng movie. And they can actually now analyze it. And I'm always happy. I don't know if in the audience there's a Doctora Paneda, okay? My co-faculty in Ateneo who also teaches PFC Matrix, okay, or Family Community Medicine in our clerks, okay? We are very happy that even though during the pandemic, paulit-ulit, every week, 7 Sundays, 7 Sundays. But each week, ang dami naming natututunan from our students. Kasi iba yung mga lens na ginagamit nila. Okay? So, that's an example. Okay? So, 7 Sundays. What other movies? Okay? If you can hold on, if you can find a copy of Magnifico, it's an old movie. Okay? So, you can also use that, Magnifico. Patay na si Jesus is also nice movie. Okay? And then, another movie pero medyo mas complex and very old na, Tanging Yaman. Okay, so you can also use this. Most recently, okay, kaya lang wala akong picture dito, is yung Family of Two ni Sharon Cuneta at saka ni Alden Richards. Okay? So alam niyo na kung anong ginawa ko noong December. No? Hindi naman. I support the Philippine movie industry. Okay? The MMFF. Okay? At habang nanonood ako, tinitinan ko din. Ano yung mga movies na pwede kong gamitin in my teaching career. Okay, so that's your instructional strategies. All right? Don't worry, malapit na po tayong matapos. Kasi assessment and feedback na tayo. Okay? For assessment and feedback, so it can be formative. So depending on the needs, okay? Depending on your needs. So formative assessment, so you can regularly assess learners' understanding during the course through quizzes. Pwede din discussions. Okay? So pagka-discussion, actually mainly here, nagpa-participate ba yung learner mo? Katulad ngayon, di ba? So yung mga sumagot lang sa chat box, yun lang yung bibigyan natin ng certificate. Tama po ba? Joke lang. Okay? So that's your formative assessment. Okay. How about summative assessment? So you can actually use this. I use PFC matrix in my courses as a summative assessment. Okay. We evaluate overall comprehension. So I give them a case or they have study, okay, and then ipopresent nila sa akin. Okay. So yun yung final presentation, and it would now assess their overall understanding of the concept of PFC matrix. Okay. Feedback loop. We provide constructive feedback to improve learning. Okay. So hindi lang siya basta present nila yung PFC matrix, but we also now check, okay, how well did they able to present and understand the concept and place it, okay, in the matrix. Okay. And if there are gaps, so we need also to correct those. So that's your assessment and feedback. Okay. And an example of which, okay, so as I mentioned, okay, so I've been using PFC matrix as a summative evaluation of my students, okay, in Ateneo. Okay, and this is an example of one slide. Okay, so they present a case, okay, for the data gathering, and then they analyze it. Okay, assessment here is controlled hypertension. Okay, but they were able to identify that this patient had poor health-seeking behavior. Okay, so management. Okay, so they will now provide, okay, the recommendations, and then they discuss it. Okay, ano yung mga relevant recommendations so that they would be able to improve the health-seeking behavior of their patient. Okay, so this is an example, okay, as a summative feedback. All right. So important when you now develop your course is evaluation and revision. Okay, so hindi siya kasi natapos lang and then you roll it out, tapos na. We continually improve. So that's your quality improvement. Okay, part of your quality assessment practices. So you collect data, gather feedback from learners, other instructors, and of course your stakeholders, your patient. Analyze the result, assess the effectiveness of the instructional design, and iterate. Okay, make necessary adjustments based on feedbacks and outcomes. Okay, so during the pandemic, as I mentioned, I've been using family um, 7 Sundays. But eventually, sabi ng mga estudyante, Doc, ayaw nyo ba napalitan yung mga movies? Tapos sila ngayon yung nagsasabi ng mga movies. Okay? At isa sa mga lumabas na movie, by the way, is Encanto. I hope you're familiar with Encanto, yung Disney na cartoons, so Encanto. Okay, very nice din, no? And aside from that, maganda yung, makikita niyo yung mga dynamics, somehow yung culture ng Encanto is also applied to Philippine setting. Okay? So, nakaka-relate tayo. And you can actually use that. Okay? So, that's a feedback. So, syempre, when we had it as a feedback, so we now try to incorporate those feedback so that we could actually be able to improve teaching PFC matrix to our medical clerks. All right? So that's your evaluation and revision. Now, nowadays, technology is important part of our teaching methodologies. Okay? And technology integration is very important as well. So if you have your online platforms, so utilize learning management systems for content delivery and tracking progress. That's what I'm doing now with our clerks. Okay? So I just developed lecture, a video, a recorded lecture on PFC matrix. So I don't lecture it face to face na. And I asked them, I place it in our LMS, and then the clerks will watch it. Okay. And then they are assigned now actual families, okay, actual patients and their families during their community rotation with me. Okay. And they will now apply. Kung ano yung napanood nila, they will now apply it. Okay. And then of course, by the end of the week, okay, they will present to me, okay, their learning. So I've used the online platform as part of my teaching strategy na. Okay. Soon, hopefully, we can invest on mobile apps. So recommend development of online PFC apps para madali na lang, or online matrix for budgeting, investment tracking, and financial literacy. Okay, I'm sorry. Financial literacy, not financial literacy. I forgot the term. Okay, but that would also be part of the improvement of our curriculum. Okay, so maybe, okay, it would also help our learners use it. Okay, yung handy na yung kanilang matrices, i-input na lang nila there. Who knows? Okay, in the near future, we'll be able to do that. Okay? So, but very important now is technology integration. All right. So we come to the end of this session. Okay, and I hope that we were able to achieve the following learning outcomes. Okay? Discuss the different components of the PFC matrix, develop an instructional design to teach PFC, and of course, appreciate the value of teaching PFC. Okay, so with that, good morning, everyone. Are there questions or clarification?
Thank you, Dr. Lims, for that very comprehensive and also brain stimulating lecture, no? So, marami akong kailangan panoorin. I only know a few um movies that I usually use in my teaching also, no? So, in the chat box, natutuwa ako kasi I see a lot of movie recommendations para ano that we can use, no, in teaching PFC matrix. There are a couple of questions po and um comments, no. I have there's I'll just read this one po, no, yung comment by Dr. Red. Nice to hear that FAMIT recommends integration of technology in teaching as it has been a global trend in medical education. So as you emphasize also in your lecture, we need to also be innovative, no, in our teaching. So thank you, Dr. Red, for your comments. There's a question here from Dr. Carl Jones Alimorong po. So as stated in the previous webinar, what are the social determinants of health that is adopted or accepted by PAFP and the one from WHO, CDC, etc.? So what do we recommend po?
Actually, we've been working on this, okay? So, and of course, we follow pa rin yung World Health Organization, okay? As you can see also, our partner, okay, the Philippine Academic Society on Community Medicine, okay, so also have relevant discussions on your social determinants of health. And of course, we integrate it as part of our, teaching, okay?
Okay, so another question, Dr. Lims, are there any existing electronic medical records or EMR that we can use for PFC matrix, no? Like family assessment tools, etc., preferably affiliated with PhilHealth, no? To have claims. Kasi yun yung trend ngayon the claims.
Unfortunately, there is none pa. Okay, so even on even on my institutions, we've actually advocated it na ipasok siya sa EMR system natin. Okay, especially that we've actually been using that matrix, okay, including the family part, okay, the family focused matrix. Okay, unfortunately, mahirap siyang i-develop. A couple of years ago, we have actually partnered with one developer. They have already been in the process of actually integrating yung at the minimum our family genogram in our chart. Okay? I think there are some EMR systems na may automatic genogram developer. Nakakita na ako na ginagamit ng mga estudyante na hindi na sila nagdodraw, as ini-input na lang nila. So, if we could actually marry that in our EMR systems, so that would be great, no? So plus the other family assessment tools that we use. The second layer of this question is now engaging PhilHealth so that they could also now acknowledge that the use of the family assessment tools is very relevant in family and community medicine practice, okay? And in the bigger context of the universal health care. Okay. So it's very important for us also to be able now to understand yung family context. Okay. And hopefully, ma-identify at ma-acknowledge sa PhilHealth na service siya na binibigay ng family and community medicine practitioners sa patient and the family. And hopefully, mabayaran tayo. Malay mo, may mga friends tayo sa PhilHealth na nasa All-Chance.
So we need to collaborate with PhilHealth in siguro developing packages in terms of yung mga PFC matrix na associated management, no? So, another question, Doc Lims, ako, ano rin ako dito, this is also my question, no? So, in a public medical setting where there are so many patients every day and where patients' primary intention is to have medicine or yung mga refill of prescriptions only, how do we apply PFC matrix, no? So, is it really feasible? Like, for example, di ba, some of our maybe faculties are teaching in a government hospital, no, na talagang minsan 50 sa isang araw ang pasyente. Is it still possible or feasible to do PFC matrix or apply PFC matrix, and how do we do it?
We've always emphasized that the patient-centered, family-focused, and community-oriented perspective in patient care is a paradigm. Okay, so technically nasa utak mo siya. Okay, when you're now talking to a patient. Okay, and how will I now be able to squeeze it in my day-to-day patient consultation? Dami yan, di ba? Lalo na kung nasa government hospital ka or nasa local health center ka, 100 everyday yung pasyente mo. Pero paano ko siya napapractice pa din yung PFC context? Okay? Let me give you an example. Okay? So hindi mo naman siya kinakailangan na lahat yon ma-fill upon, no? 'Di ba? So I will ask, 'di ba? A 45-year-old male patient coming in for elevated blood sugar, okay? So I would now ask relevant information about ano yung mga risk niya, may diabetes po ba kayo? Okay, dati na ba kayo nasabihan na may diabetes? Okay, may mga iba pa po ba kayo nararamdaman? Kumusta po yung pag-ihi ninyo? May mga pangangati ba kayo? Etc. That's the biomedical component. Okay? Of course, okay? Let's go to the management. So malamang po meron po kayong diabetes. Okay? At ito pong gagawin natin, no? Dahil hindi pa tayo sigurado. So gagawa po tayo ng mga laboratory. Okay? So sa laboratory, magpa-request po tayo ng FBS. Okay? Siguro para ma-assess po natin. No? Hindi, basic lang to, sample lang. Baka mamaya sundin nyo ako, ito lang yung gagawin nyo sa mga diabetes nyo. Okay? Okay, so FBS, okay. Pero sa tingin niyo po ba kaya niyo po magawa yung FBS? Okay? May oras po ba kayo? Kasi ano po kayo nito, magfa-fasting po kayo dito. Okay, so 8 hours po 'yan. So hindi po kayo mahihilo. Ano po bang trabaho po nila, etc. So you have actually now starting now to look into the psychosocial part, okay? And then, okay, yung finances, which is a very important part of the patient-centered. Okay, so kaya po ba? Actually, may libre naman po yata tayo. Okay, so pwede nyo pa. Or if you know community resources, in Payatas, where I have our community for internships in Ateneo, okay, we have actually know that there's a counselor, okay, who provides medical assistance. Okay, so we explain it, okay, to our patient. Actually, meron pong binibigay si konsehal ganito. Okay, pipila lang kayo pero at least yun libre. So pwede nyo mapagawa po doon yung examination nyo. Pagka napagawa po yung examination nyo, pwede po kayong bumalik dito. Okay. Saan papasok yung family? Okay. Meron po ba kayong kasama po sa pamilya? Meron po ba kayong ibang family members na pwedeng sumama sa inyo sa pag-follow up nyo para tulungan din namin silang ipaliwanag kung ano po yung sakit ninyo, etc.
Yeah, actually, parang
So
kapag
siguro mga 2 minutes or 3 minutes.
Yeah. Actually,
So,
sorry, Doc Lim, sige. Go ahead, Doc Lim.
yeah, go ahead.
So, parang kapag everyday mo siyang pinapractice, nagiging automatic na, no? And we're not parang unknowingly na nagagawa natin yung PFC matrix ng mabilis din if we always practice that. There's a question here, Doc Lims, kasi we talked about yung mga OPD, no? So, meron po daw bang role ang PFC matrix, for example, in the emergency setting? Kasi some of our residents also rotate in the emergency setting, di ba? So, sa tingin niyo po is it applicable or?
So, very important yung sa needs assessment natin, diba? So you have to really identify ano yung needs mo din, okay? So kung nasa ER ka, baka you're pressed with time, okay? So siguro a relevant information, siguro mabilis lang, okay? So sino yung ibang family, ano yung sakit ng pasyente, so that's your biomedical. In your mind, ano yung pwede ko maging treatment for this patient? Ita-triage ko ba to or should I initiate emergency medication? Okay? And then identify na kung may other family members around. Okay, so tatanungin mo ngayon, kaano-ano niyo po yung pasyente? Pwede po ba kayo mag-decide para sa pasyente? Okay, so medyo may assessment ka na din doon, di ba? On who are deciding for the family. Okay, so ito po ba, mabibili niyo po ba ito? Sorry. Sorry dun sa tanong na yun. Pero totoo naman, no? Tinatanong niyo
Yeah.
naman, ito po ba, mabibili niyo po ba ito? O may iba pa po ba kayong kasama para mag-asikaso ng mga ibang bagay? Para maasikaso po natin yung pasyente po ninyo, etc. Okay? And then, okay, hindi ka muna tatakbo sa community para alamin kung ano. Your resources in the hospital would be the community-oriented part. Okay? So what are the services available in your hospital to manage your patient at the emergency room setting? So again, your PFC is a paradigm. Okay, it's a paradigm that it's in your head. Okay, and we've been actually using it. Okay, hindi lang na, albeit we don't know the label. Ginagawa nyo na po yan. Di ba? Tinatanong nyo yun. May pera po ba kayo? Sorry, bumabalik ako doon. May pera po ba kayo? Etc. Kaya nyo po ba ito? Sino yung makakasama ninyo? Etc. Nasa ER yun. So, it is actually applicable. Okay, so but of course it would take some time for you to be able to develop it, okay, and talagang integrate it. Okay, hindi ka naman upo doon, gagawa po muna ako ng matrix, etc. Of course you have to ano naman, kailangan mo alamin kung nasaan ka, di ba? So if it's an emergency, of course you still need, okay, prioritize life first before completing your PFC matrix.
Yeah. So, Doc Lims, meron akong mahiyain na friend. Ang tanong niya is, kailangan daw ba ang PFC matrix na gagawa in just one sitting or it can be, ang tawag ito, parang for every follow-up, parang kino-complete mo siya.
Number one, kunyari for students who are rotating with you in the community, okay, they can actually, during the whole time that they are rotating with you, they can actually input. Dahan-dahan na lang i-develop yung matrix, okay? So hindi naman siya one-time sitting lang. Ang pagod nun yung pasyente at saka yung family niyo. Mairita pa sila sa iyo dyan. But what I emphasize is that you can actually finish the matrix while you are rotating with me. Kasi at the end, okay, tatapusin mo naman yan kasi yan yung ipipresent mo sa akin. Okay? So for outpatient, okay, follow-up, okay, yeah, I think we can do that. Okay? So especially kung wala naman other family members, mahirap namang i-assess. Remember, okay, for example, sa UPGAR natin, di ba? You don't do UPGAR with just your patient. We also ask, okay, the other family members. Okay, so we can invite them to the next follow-up. So gradually, nadadagdagan yung PFC matrix. Okay? Actually, this is a good opportunity for our audience. Okay? For those who would want to ask their questions face to face, we
Yeah.
can invite you to open your cameras and ask your question. Please introduce yourself and your institution if ever you would want to join
Actually, may
us.
mga naka-raise na hand eh. Hindi ko lang po alam. Kasi parang ito yung sa
Sige,
movie pa
let's
kasi. Baka hindi
invite
yung
Dr.
baka
Kim
hindi yung
po.
sa Yeah, yung mga naka-raise po ng hand.
Dr.
Si
Clyde
Dr.
Kim po.
Clyde,
Do you have questions po ba?
may question? Yeah, maybe you can turn on your video and also your audio so we can hear you.
This is an interactive po ha.
Ang
So,
daming
if you
magandang-
notice, hindi po namin siya webinar. Meaning
Yeah.
webinar setup. So that the audience can actually join, okay, open their cameras and ask questions if you would want. Because we want this to be an interactive session. Otherwise, kung gusto lang po natin kayo matuto, ay nag-webinar na lang tayo. Para wala na yung time na unmute.
Hello, good afternoon po. Good morning po, Doc. My question is, how can we apply the PFC matrix in terms of like in palliative setting?
Oh, palliative.
All right. Is that question addressed to me or Dr. Ara?
Yes.
Pero I can guarantee it's very, very useful. Core element din namin ng But Dr. Lims, what
For
is
example, if you have a patient referred to you in palliative care, okay, so what would be of course, the reason why of the referral, okay? Example lang po to ha, hindi ko siya generalize, okay? But sometimes the simple referral sa atin for is for family meeting. Tama ba, Ara? Diba? For refer to pallia para sa family meeting. Okay. So when you now meet your patient, okay, so of course you assess the needs of your patient. Okay. Why is your patient in palliative care? So that's your patient centered. Okay. family-centered. Okay, so of course, very important for us, yun yung reason of referral, family meeting. So you identify who the other family members, okay, you need to engage during your family meeting. Okay, and now if there's an opportunity for you to be able to do other family assessment tools, such as your UPGAR. Okay, very important yung UPGAR so that you would be able to measure the dynamics, okay, of the family. Okay, so you can use your UPGAR. If not, at talagang family meeting lang siya, then identify, okay, and apply your concepts in family meeting. Okay, and then of course, very relevant is that what are the services that is available for the family, okay, in your institution that is already your community-oriented aspect. Okay, so in terms of financial, okay, so you also discuss that, okay, especially if the institution hindi free yung palliative care. So that's already health financing, and again, it would fall on your community-oriented. So again, okay, your PFC matrix is practically can be applied to your palliative care setting.
Po, Doc. Thank you po, Doc.
Sorry, hindi detailed, sample lang.
Doc,
Thank
thank you po.
Thank you. Actually, talagang, at saka, we just want to emphasize, Dr. Lim, so as you mentioned in your lecture, yung mga prerequisites no, ng mga kailangan natin. The family assessment tools, 'di ba? Yung counseling skills natin, those are very important part talaga
Yeah,
before we do the PFC matrix.
that's why I included it as an assumption. That at
Yes,
least the basic concepts in family community medicine we are aware of, so that we could actually be able now to teach the PFC matrix. Okay. Now, for some who may not be even the basic, for some who do not use the biopsychosocial approach, okay, so we can actually now provide, okay, support in teaching biopsychosocial approach. Okay, so that you could be able to effectively teach it, okay, in your students and your trainees, okay, and even apply it in your individual practices for those who are practicing already.
Yes. Doc Lims, ang daming magagandang comments. They're very thankful for your lecture, no? Gusto
Maraming
ko lang
salamat
yun,
po.
gusto ko lang may isa lang akong babasahin, Doc Lims, kasi si Dr. Charity graduated 32 years ago. So the PFC matrix was developed by Dr. Relio Pando in 2000. I highly appreciate this lecture because during our time, FAMED was so simple. However, what have been taught to us, what we have been doing all along ay nagkaroon na ng title. More specific and more concise, more structured, more detailed and more comprehensive, more of everything. So thank you for your lecture, Dr. Lims.
Thank you very much, Dr. Besidyo, for that
Opo. So,
warm
yun.
message.
Opo. May isang question dito, Dr. Lims, by Dr. Columna. Do we have a venue to integrate the skills in all primary care physicians aligned with the implementation of UHC? Siguro the application of the PFC matrix po.
All right. Hindi ko alam paano ko siya sasagutin. But the more practical answer would be that, okay, so the PFP and the FAMED, okay, and now the Committee on Basic Medical Education has actually collaborated so that we would be able to identify these various needs, okay, in terms of knowledge and skills, okay, for fellow faculty to develop so that they would be able to effectively teach these concepts, okay, relevant to the universal health care. Okay, so remember that when we talk about universal health care, okay, there are a lot of competencies expected from us. There's individual competencies and your teaching competencies. Okay, so sige, let me just tamang-tamang kakadiscuss ko lang siya. Okay, quickly lang ha, give me a sec. I hope I'll be able to find it. But just for example, okay, so of course it cannot be taught in just one sitting. Okay, so very important, of course, to be able now to identify, okay, ano-ano yung mga different wait, ang hirap pala magsalita na naghahanap ng file. Okay, but here it is.
Multitasking si Doc Lims.
Yeah. But I would wanted to actually emphasize this part, no? So that you would be able to appreciate it. Okay. So these are actually core competencies of a primary care that is being expected from us, okay? And this is a Department of Health, this is a Department of Health, what do you call this? Material, okay? And if you would look into here, you have your individual competencies and your team competencies, okay? PFC, where will PFC come in, okay? So actually your PFC can actually now go into your individual, actually lahat, okay?
Yeah.
Kasi yung individual and family, okay? So you would be able now to look into your first contact of care. So that's your patient-centered, providing comprehensive care and continuing care. So that would now also engage, okay, your family, coordinating care. So that would be your, tawag dyan? Your community-oriented, di ba? So you identified what are the resources available to your patient, even other services. Okay, so if you need to refer your patient to a particular service, okay, so UHC, that is your healthcare provider network. Okay. Of course, relevant is your patient, is your managing patient records. So hopefully in the future, we will be able now to integrate PFC in our EMR setting so that it could also be now be used. Kasi makikita mo na doon, di ba? Pagka pinasok mo na yung family and then pinasok mo na yung mga community-oriented items, okay, so alam mo, may understanding yung doktor, not just of the individual patient care, but now looking into the bigger aspect, okay, looking into family resources and community-oriented perspective. Okay. And then the team competencies, of course, that's promoting health, that's part of our practices, and you're implementing public health and population health. So that's your community-oriented primary care, which is, of course, relevant to your community-oriented care or perspective in your PFC. So this is very important for us. Okay, so and hindi siya kaya ng isang setting. Hindi siya kaya ng isang upuan. So we're actually preparing this collaboration with Basic Medical Education and FAMED, okay, to look into these various topics, okay, and then what do we call this? Translate it into sessions like this so that the co-faculties can be able now to appreciate, okay, ganito ko pala siya dapat isa-set sa aking instructional design, and this is how I would be able now to teach.
Yes.
I hope
So,
I answered the question.
marami pang maraming opportunities talaga for teaching PFC matrix. I think sabi nga ni Doc Gia, nag-uusap kami, maganda siyang topic talaga for a workshop, yung PFC matrix, since it's going to be the core elements of our management also, no? So Doc Lims, meron kasing question dito na do you actually na partly na answer na, no? Do you recommend in every patient consulted in OPD and ER to have a PFC matrix form, or baka may move ba, or is PAFP doing parang a form, or paano ba to, parang a pathway PFC matrix form para to be cascaded in the different training institution, I guess. And meron another question kasi, sir, here, do we have PFC matrix for all OPD cases, especially for chronic diseases, cancer, psychosocial issues, sexual abuse, drug users only? This is from Dr. Arnold Roque naman po.
Let me answer the second first. Yung
Yes.
family healthcare program. So if you in your department you have instituted the family healthcare program, we actually engage, okay, and encourage the use of your PFC matrix and include it in the patient chart. Okay, so I'm not sure if the UP is still doing that, okay? But alam ko dun sa family healthcare program natin before, okay, meron siya na naka-incorporate yung chart, okay? Para nandun na siya. And every time na i-review yung yung case, nandun na siya and identified siya, okay? The first one, sorry, I forgot. Are there initiatives, okay?
PFC
So,
matrix form, sir.
yeah, so other initiatives, okay, so of course we've been advocating that, okay, but definitely, okay, so it's really difficult, okay, but we encourage individual initiative to incorporate it again, okay. For me kasi it's more of a paradigm, nasa utak ko siya, okay, so and it's during the reports, etc., okay, na doon lumilitaw yung matrix, but otherwise in my actual day-to-day activities, okay, naka-PFC mode yung utak ko. And when I talk to patients, so naka-PFC siya. Okay? So takes practice for everyone, okay? And of course, at the moment, at our level and at our need, okay, so how do we teach this to our students so that eventually, okay, ma-inculcate na sa kanilang utak yung pag-iisip na okay, dapat hindi ako titigil sa patient-centered lang. Dapat makita ko yung family and then the community.
Yes. Okay, so wala na masyadong questions, Dr. Lims, but there are really a lot of comments.
We will review po the
Mhm.
medyo mabilis po yung akyat eh.
Yes, opo,
Mahaba. So
opo.
sorry, hindi po namin even myself, kaya kanina tinitingnan ko pa po. Pero hindi ko na ma-follow. Si Ara na lang. Makikinig na lang ako sa tanong ni Ara. Or yun nga po, if you could raise your hands, if you have some
Yeah.
comments, etc., questions, so you can do that. So we appreciate that. So that
Yeah, so we have an
May
sir, we
pahabol,
have a
Dr. Areta.
question. Dr. Reta. Dr. Reta, please unmute your mic po, and if you can also turn on your video.
Mike na lang po, good morning.
Okay. Good morning po.
Okay lang. Though I'm listening kanina pa po, no? So, reviewing sa mga comments kasi nila, parang they're thinking of the PFC matrix is para siyang a form to be filled up sa ER, OPD, or something. But para sa akin kasi sa pagkadinig ko sa lecture ni Dr. Abrohena, it's a concept actually. It's a paradigm. You don't have to fill up a certain form for that. Kasi incorporated na siya. Integrated siya sa ating practice na. So kasama na siya sa family assessment natin, sa individual assessment natin, sa kanilang community. So hindi talaga siya form. Pero integrated siya para siya naka-second nature dapat sa atin. And that's what we are going for doon sa ating presentation ng PFC matrix. Sorry, medyo yun po. So para siyang concept actually. It's not a form that they are looking for na kailangan na lang fill upan sa ER. Parang ganun.
It's not a
But if you
checklist.
Yeah, oo. But if you want to present it sa conference, if you want to review kung ano yung natutunan ng resident ninyo, pwede niyo siyang i-discuss sa conferences ninyo. Pwede silang mag-notes, pwede silang gumawa ng different form for their own consumption. Parang ganun.
Yes,
Yun po.
thank you very much, Dr. Rata, for that. So, as I've emphasized, okay, it's a paradigm of healthcare, okay, looking into your patient-centered, family-focused, and community-oriented perspective when you now do take care of your patient. The chart, the matrix, is a guide for us because, of course, some gusto nila may sinusulat or something like that, okay? But the PFC matrix is very relevant to our students and trainees, lalo na. Kasi we require them to do it. And the only thing that we can require that they're doing it is to apply it and filling up the table. Hence the example earlier. If you notice, if there's one slide there that I showed you, isang isang Zoom session wherein my students present now the PFC matrix. Okay, so there are actually a lot of best practices. I'm not sure if Dr. Jake Cortez is in the house, okay, so but maybe he could also share, okay. There are a lot of he also been teaching PFC with his students, and I saw one example presentation of his students. That's very nice as well, okay. So you can also take a look on that, okay. So you as a teacher, okay, it would depend on how you would want your students to present it. Okay, so nasa creativeness na natin yon. Okay, so ako, tawag dyan, lagi simple. By the way, just a disclaimer, no? Since I use it as a summative part, okay, and then I'm always pressed with time, I always tell my students, okay, please present your PFC matrix in 15 minutes. So, bakit ko kinakat to 15 minutes, okay? So, it would also provide me an idea na kaya ba nilang mag-analyze at mag-synthesize ng kanilang maraming alam into this particular form. So that's also part of my evaluation. Kasi pag may mga residente ka na ang haba-haba na, ubos na yung 3 oras, dinidiscuss lang yung patient-centered, alam mo na hindi nila kayang i-synthesize yun. And then that's part of our skills as well na tinuturo, no? So it depends on your creativity on how you would now engage and facilitate your students and trainees. Okay? And in what we're doing in our PFP webinars, okay, our practitioners in family community medicine. Okay, Dr.
Okay,
Javier,
RJ.
hindi ko muna hindi ko muna announce yung good
In the
news, but soon.
Hi,
Hello,
Dr. Lee.
good morning, Dr. Lims and Dr. Ara. Siguro I just
Opo.
I want to share lang yung experience ko from teaching family and community medicine over the years. I know for a fact na medyo difficult talaga yung community-oriented tier, the one that you're saying, no? Sa akin, I also try to incorporate, di ba remember part of our roles as navigators of the service of the healthcare provider network, we also try to establish linkage and networks. So sometimes I also try to incorporate a little bit of other existing laws, health legislation that pertain to a particular medical condition that would augment or that would help better the ability of our patients and their families to cope with the medical condition. So for example, kapag we're talking of, let's say for Doc Ara, no, in terms of hospice and palliative medicine, do we also incorporate yung mga Z package, yung mga nasa batas? Or for example, when we're talking of the PLHIV, how does the law protect our PLHIV from a community-oriented perspective? We also try to teach that to our students, or linkage. For example, if you're dealing with patients who belong to the autism spectrum disorder, we try to see ano ba yung sinasabi ng PWD law. And
Yes.
for me, that's also important na yung thinking outside of the box. And I agree with Dr. Lims. It's hard to assess the trainees and the students' capacity to really put the PFC matrix in actual practice if they are not able to verbalize in a short period of time their concrete plans. So maganda yung sinabi ni Dr. Lims na we have to be very creative and at the same time holistic, and we also try to communicate this effectively to not just the patient and the family, but even to the members of the society or community who may also play a pivotal role in terms of the holistic approach to the medical condition. Again, utilizing availability of resources from the local health centers or from other community partners, from NGOs. So parang for me, ito yung mahirap. Maganda yung konsepto na meron tayong conferences, kasi sa conferences, this is where you can expound on what you think are necessary. Pero sa akin na starting point na at least sa isipan natin, we are already putting that into every endeavor that for every patient engagement, patient encounter, we think outside of the box, we go beyond the biomedical and always factor in the psychosocial dimensions of that particular medical condition. And I think this is a very good discussion among members of the academe to really parang let's really have strengthen yung power natin, no, as family physicians, and how do we train the future medical frontliners of our community if we are really hoping to be the gatekeepers of when the Republic Act 11223 is in full implementation. We want to see how our trainees, our students will put into practice some PFC matrix. So again, congratulations to both PAFP and FAMID for this specific interactive lecture workshop. Thank you.
Thank you
Thank you,
very
Doc
much,
RJ.
Dr. RJ.
Ito po.
Can we call Dr. Celosha?
Celosha.
Yeah.
Thank you, Dr. RJ. Dr. Celosha.
Sabihin ko doon sa mister ko, pakisaksak nga.
Can I be heard?
Yes,
May
please.
alcohol, doktora din ah.
Ito po, may
So,
ano na po.
Wet.
Ayan po. Sige, Dr. Celosha.
I'd like to thank Dr. Abrahena for the very insightful and very relevant lecture, but I just like to share lang siguro din what we do in our institution, in Cebu Institute of Medicine, with our 4th-year senior clerks in the community. So I think the patient-centered approach is very easy, and the family focus, that's where we also teach them. They usually get a patient from the community, and then they analyze, of course, after getting the patient-centered approach, they analyze the impact, using the different tools in family medicine. Yung community-oriented approach is, as you said, medyo challenging, but what we do, we also still use the tools like the screen and the family approach to analyze
Pinahin nyo na lang.
and then after that, we use the fishbone analysis to look into the social determinants of health. And then based on the family situation, given also that the patient and the family that they are having is like a representative also of the population. No? So, and then after that po, of course, after analyzing sa assessment ng barriers to healthcare, we try to apply, aside from, like, for example po, yung DOH programs, we have a case of hypertension. We look into, like, for example, the PhilPen, and then I ask the students to interview, for example, at the DOH level, ano yung implementation or expected ng program or objectives ng PhilPen program at the DOH level, regional level. How is it being implemented in the local government unit? And then how is it implemented in the barangay? And then they will see nasan yung mga gaps or kulang sa program implementation, like the lack of healthcare workers, medyo passive yung surveillance sa community. So, and then after that, they also give lectures to the community based on this, because sa community, minsan mga people, they don't know actually the existence of the program and what resources that they can avail in the barangay level and the LGU, the city health level. So that's how we incorporate the community-oriented aspect of the PFC matrix. Yun lang po. Thank you very much for allowing me to share.
Thank you very much, Dr. Annalie. Okay, so Dr. Annalie is one of our very good faculty, especially there in CIM. Okay, so she's also been giving lectures, okay, and sharing sessions, okay. Diba, Annalie? So we hope that we could also hear, okay, elaborate natin yung mga other activities ng that Dr. Annalie had been using as a strategy, okay? Because there's a lot that I have learned from her. Okay, thank you very much, Annalie. Okay, an emphasis actually for everyone, okay, is that you have to adapt it to your rotation, okay? So our presentation this morning is not prescriptive. Okay, so it depends on how your school needs it. Okay, so kaya kanina, di ba? Pinasok yun, may first year, pwede nyo ipasok sa first year, second year. Or kunyari, sa clerks, kunyari ako, ang clerks ko, 1 week lang nag-rotate sa akin. So, kaya ba nila? But so far naman, kaya nila. If I have an 8-week rotation in the community, mas better yon kasi makikita nila yung buong spectrum. Or kunyari, wala kang ganun ka-opportunity. Okay, pandemic, wala kang actual patient and family engagement. So what can you do? Okay, so you can actually now look, be creative, create movies that you can now use as case scenarios or case samples for your patients. So you really need now to adapt. Okay, when you now make your instructional design, part of your thinking is that kaya ko ba to? Saan ko to ipapasok? Sino yung mga trainees ko? Okay, and then saan yung setting? Ang galing ng kina Dr. Annalie kasi may community sila. Ganun din si Dr. RJ. Okay? So you would see, no, na kung meron kang setting, pwede mo ngayon i-apply sila or something like that. Okay? So thank you very much, everyone.
To the interest of time, we cannot accommodate more questions, pero may naka-raise ng hand. Last na. Si Dr. Uyselias po. Can you unmute your mic? Yes.
Po. It's not. I don't have any questions. I just have some comments regarding the PFC. So patient the patient center is yung sobrang easy part na lang po kasi you treat the patient as you see him and then do the preventative stuff po. Pero kaya yung sa family, ang nakikita ko po kasi na nagiging problem with how training goes sa Philippines po is we have certain meron po kasing limited time for the interview, so that's why minsan po ang nangyayari, rather than have everything done during the 15-minute visit ng pasyente, kasi ang nagiging problema po natin, especially with the government institutions, is yung sheer amount of time na ibinibigay dun sa pasyente. So hindi po lahat nakukuha na ano yung mga sakit ng pamilya, hindi po lahat nakukuha yun. Yung vaccine history, hindi nakukuha lahat yun. So hindi po natin masyado natututukan din yung family part po, no. So ang benefit po kasi if nagagawa natin yun is pag nakita natin yung chart ng pasyente, then nakita natin na yung patient na to, may family history siya of breast cancer. So do we need to do the preventative part para maiwasan na dun na sa treatment, kasi lagi nangyayari na dun na tayo sa treatment part. Pag na-diagnose na, saka na lang natin nakakatch. So hindi po tayo proactive na bago pa mangyari, tignan muna natin para hindi lumala or madali. Kasi kagaya po, actually I'm in the US ngayon po. So I'm working with a family physician here in the US. So ang nangyari po, nakikita ko sa kanila, nakikita nila na meron silang annual visit talaga that is specific for a well adult consult or well child consult, which is pag nakita nila yung pasyente, ito yung may family history siya ng colon cancer. So the screening for colon cancer is 45. So ngayon, based on guidelines is 45, pero dahil yung parent niya or someone from her family is diagnosed at an early age, so magma-minus po siya ng depende dun sa type na yon. Sa time na yan, halimbawa, na-diagnose po at 50, so magsa-start sila ng screening at age 40. Pero yun po, naintindihan ko naman na kasi hindi lahat may provisions for healthcare. That's why we need to do the preventative stuff, gaya na lang po ng vaccines. So doon pumapasok din po yung sa community. Sa community kasi, halimbawa, nakita natin na marami tayong cases ng measles now. So ang nangyayari, ini-increase, ginagawa natin ang measles vaccine at 6 months rather than 9 months kasi needed siya at that time, or yung mga ganun pong factor. Halimbawa, sa isang community na madaming cough, colds, or something, kasi hindi naman natin makokontrol yung crowding index ng isang family. But we can control how it is transmitted. Like, magturo tayo sa community ng hand washing, ng mga basics ba na to prevent spreading yung mga communicable diseases. No? So yun po yung point ng PFC. Kaya natin siya ginagawa. Hindi po siya dahil lang kailangan natin pahabain yung chart. Hindi po ganon. So yun po yung dahilan ba't ginagawa yung PFC. Yun po yung natutunan ko during my residency.
Thank you very much, Dr. Uisalis, for that sharing. Okay, and indeed, okay, so as I emphasized earlier, okay, so this does not need be an added burden to everyone. Okay, so as a paradigm of healthcare, okay, so you really look into how you would now approach your patients. Okay, and as you have seen, we have also emphasized on the preventive and promotive aspects of care. Okay, Ara, there are a lot of hands already
So
raising their
Dr.
hands. But I
Barbie,
think, do you need
Dr. Barbie is one of the magtatanong sa
Sige, so
Please,
and
please,
Dr.
please,
Ray
Dr.
Salinel is also raising his hand. So maybe we
Opo. So,
accommodate pa. 2 more.
yes, sige. So, sige, 2 more. Last 2 more. Dr. Barbie and Dr. Salinel.
Hello.
Sige.
Hi,
Ay,
sir.
sorry. Sige, sir. Kayo po muna. Go ahead, sir.
Sige, I'll let Dr. Barbie to
Okay.
to
Sige,
raise
Dr.
her
Barbie first. Okay po. Dr.
Okay.
Barbie.
Sige. So, I've been hearing a lot of comments kasi na government hospital, there's little time and all of that. The thing here kasi, alam natin yan, ang daming pasyente. You know, one of the things that I think you can do pag ganyan is to identify 'di ba? Kung sino yung kailangan pabalikin. The good thing about government hospitals, libre ang follow-up. So you know, when you lack time, lagi natin sasabi kulang sa oras, edi pabalikin. No, make time for these patients that you identify na would require additional intervention. Yun lang muna. So mabilisan, pero parang meron kang ma-identify na, oh, mukhang kailangan ko balikan tong pasyenteng to, ipabalikin mo. You know, that's how you address that yung patient load na problema. Yun lang po. Thank you.
Thank you very much. Dr.
Thank you, Dr.
Ray.
Barbie.
Yes. I would like to say thank you very much, Dr. Aburhena, for that wonderful and very clear lecture about PFC. And saludo ako sa iyo. Okay? Ang gusto ko lang sabihin, kasi I've been hearing a lot of questions about the time, the sheer time, ganyan from government. Buti na pinauna ko si Dr. Barbie. Kasi yun din sasabihin ko sana na if you having a difficult time of you know, masyadong lengthy yung pagtatanong tungkol doon sa do we have a standardized form ba na we can share it to every training institution ng PFC matrix po ba, Doktor? Meron ba tayong ganon?
The one that I shared, the first slide, sir. So the first slide that I shared is actually a standard content, okay, that have been promulgated by Dr. Leopando, and it has been actually been improving. So that's the latest, the one that I actually shared as my first slide, okay, and that is actually available. So we hope that we can actually share it. If I remember the last 2 weeks, okay, Dr. Leopando have actually agreed na magproduce, okay, she's now asking the academy to produce that that one-page form so that it would be shared to all and also be posted in our website para maging downloadable siya. It would also be a guide for our members as well.
Oh yan. Thank you so much for the information, Doc. Kasi gusto ko sabihin ko baka kung pwedeng i-print, giving us permission na i-print yung standardized form na yun. Number 2, tama yung sinabi Dr. Barbie na kahit kung hindi naman matapos yung questioning mo doon sa PFC, pwede naman kasi pabalikin yung pasyente. Follow up na lang para kompletuhin yung pong information. Doc, pagka for example, pagbalik ng pasyente may panibagong complaint, do we have to make another do we need to make another PFC form, or paano ba yon pagka may bago siyang complaint,
Really,
or
no?
parang may follow up na lang doon ilalagay doon sa form?
Yeah, I in my practice I usually just add a follow up, okay, especially in the patient-centered part. So para at least ma-relevant siya, ma-identify pa rin na oops, may mga na na-update yung at the patient-centered level, na-update yung status ng ating pasyente.
Ayan, thank you so much. Yun lang po, sir.
Thank
Salamat
you.
po.
Ingat mag-drive, sir.
Thank you, Dr. Thank you, Dr. Ray. Ayun, so we have so many questions and comments pa po, Dr. Lims, but due to the interest of time, we will cut our question and answer portion. So for those who are asking for sample PFC form po, so as mentioned by Dr. Gia in the chat box, we have the materials po at the reference section of our website. Thank you also to Dr. Gia and Dr. Noel Laksamana for helping moderate our chat box. Okay, so again, thank you, Dr. Lims, for that very comprehensive lecture, and also thank you to our attendees for being so engaging and very interactive in our session for today. So to formally close our webinar for this morning, may I call on the chair of the FAMMed chair for the CME committee, Dr. Marlene Reconcheca.
Yes, thank you, Dr. Ara. I hope you can hear me.
Yes, ma'am. You're clear.
Yeah, thank you. So it has been a very fruitful Saturday morning So just to recap po this fruitful activity, before we truly end, our resource speaker, Dr. Abrahena, was able to achieve the learning outcomes for today's activity as we were able to review and relearn the components of the PFC matrix, or the patient-centered, family-focused, and community-oriented matrix. The nitty-gritty details of each component of the matrix have been discussed comprehensively. It was emphasized that we also need to take into consideration the biopsychosocial and ethical aspects of an individual that are relevant to our care. The beauty of our family assessment tools and systems were equally emphasized, as these tools will equip us to assess families and be able to correctly intervene and address the identified concerns. And lastly, having the understanding of the social determinants of health and health systems relevant to the case will enable us to intervene at the community level. We were also able to learn how to develop an instructional design to teach PFC by first identifying the audience as to whom you will apply the PFC matrix. It is also a need to determine what your learners want to know by establishing your SMART goals. This will help you to truly achieve your objectives for your learners. HOTS, or higher order thinking skills, will assist you to formulate objectives you need to set. Dr. Abrahena assisted us as to how to develop an ID by providing examples on how to make an actual one and encourage us to actively participate in doing one. Learning activities and strategies will enhance your learners by engaging them with your activity to make sure that they truly understand your activities, objectives. Lectures, demo, return demo, reflections on certain social media platforms are some of these strategies that can be employed. And lastly, in doing our instructional designs, we need to set our assessment to determine if our learners truly learned through the different strategies we used. Feedback serves as an avenue as to how to improve our activity and for our learners and for us teachers as well. So the PFC matrix is indeed a very useful tool to be incorporated in the curriculum framework for all our programs. And issues such as social determinants of health, incorporated in teaching a PFC matrix, challenges of addressing community oriented concerns in the premise of legislations, incorporating EMR in the writing of PFC matrix, challenges of conducting such PFC matrix due to limitation of time, and marami pa pong iba were also discussed and tackled during the Q&A. So talagang very engaged ang audience natin. Even others share their experiences, showing their interest in this topic. So para segue lang po, please attend the activities scheduled in the convention spearheaded by FAMED together with PAFP. And so on behalf of the Philippine Academy of Family Physicians and Foundations for Family Medicine Educators Incorporated, I would like to thank each one of you for attending, actively listening, and participating in this morning's activity. It was a truly productive morning to all of us, but we are hopeful that these learnings will be put into action, hindi lang po matapos dito, as we all strive to standardize our teaching learning activities to our learners, may they be medical students, clinical clerks, postgraduate interns, or residents alike, aligning with your own respective curriculum by integrating this beautiful paradigm we call PFC. Again, thank you and have a wonderful day ahead, everyone. Back to you, Dr. Ara.
Thank you, Dr. Cheka. So yes po, no, this is really a very informative and very it's beneficial for all faculty. We just want also to take this opportunity to invite everyone, encourage everyone to be a member of FAMED, no, the Foundation for Family Medicine Educators Incorporated. No, so you can message us or use the description po, no, also message or email the foundation to be a member. So we will be posting the evaluation form, but before that, we would like to ask everyone to turn on their videos. Ayan, so we will have a documentation for this morning's webinar. So we are 900 plus po. That's a combination of Zoom and Facebook Live. Okay? So Evan, count ka. Sir Evan. Count ka
Page 3 na po.
Ay, page 3 na pala. Smile lang tayo po.
Smile lang po. Page 4. open lang po ng cameras po natin.
Ayaw naman. Ayaw, duwag.
Tapos ka na ba, Ivan?
50 pages yan.
50 pages.
Okay na po, Doc. Ang dami po. Thank you po.
Thank you very
Thank
much,
you.
everyone.
Thank you, everyone. So,
Thank you for that.
we will now be posting the QR code for the evaluation form. Si Dr. Will also posted the link for the evaluation form po. Yes, so Evan, maybe we can post now the QR code for the evaluation. Thank you po for attending, everyone.
Maraming salamat po. See you in the convention.
See you po.
Thank you po,
Thank you,
Dr.
everyone.
Glory.
po.
For the members,
thank
please
you.
update your contact details.
Yeah. Mm.
Yeah. Thank
Thank you,
you.
everyone.
Doc Lims, Doc Ara, maraming salamat.
Thank you, Dr. Juliet.
Dr. Cheka,
Thank you. Thank you.
Thank you, Dr.
Thank you,
Evan,
Mars.
thank you.
Thank you, Dr.
thank
Glory
you.
Leiva.
Thank you,
See you sa
Evan.
convention.
Bye. Enjoy
Please
your
update
weekend.
your contact details, everyone.
Oo nga, marami hindi nag-update.
Please update your contact details. Thank you.
Thank you. Enjoy your weekend.
Salamat po. Bye-bye po.
Thank you, Dr. Cheka. Salamat
Thank you,
po.
Dr. Mars. Thank you, Dr. Ara. Thank you, Ivan, and the PAP staff there.
Doc Lims, ang dami
Thank
mong
you po, Doc
comments.
Limen.
Napit na
Mara, thank you
lahat.
po.
Thank you, Evan.
We'll just review that. No?
Yeah,
We'll just review
ano po,
the chat. Meron naman tong meron naman, na-save naman yata.
Umabot ka hanggang US of A, Doc.